Women whisper about it in hushed tones at brunch. Men joke about it nervously in locker rooms. And the internet has turned it into an endless source of memes and misinformation. Penis size has become one of the most anxiety-inducing topics in modern sexuality, yet rarely does anyone stop to ask what the actual evidence tells us. Strip away the bravado, the exaggerations, and the cultural mythology, and you're left with a surprisingly straightforward question that deserves a data-driven answer. What do women actually prefer when it comes to penis size? And does the reality match up with the stereotypes we've been fed for decades? Dr. Emma Blake, a board-certified urologist and sexologist, has dedicated considerable attention to cutting through the noise surrounding this sensitive topic. Her approach is refreshingly scientific, relying not on anecdotal evidence or locker room tales, but on carefully conducted research that examines actual behavior rather than self-reported claims. The distinction here is crucial because what people say they want and what they actually choose when given complete freedom are often strikingly different things. Social pressure, the desire to fit in with peer expectations, and even the influence of pornography can significantly skew verbal reports. But purchasing behavior, the private choices people make when no one is watching, tends to reveal more authentic preferences. One of the most ingenious approaches researchers have taken involves analyzing the sex toy market. This method sidesteps the problems inherent in surveys and interviews, where respondents might feel pressured to give certain answers, or might not even be fully aware of their own preferences. Instead, scientists looked at what women are actually buying and using in their private lives. The logic is elegant in its simplicity. If you want to know what women genuinely prefer, look at the products they voluntarily purchase with their own money for their own pleasure. These are decisions made in complete privacy, free from the judgment of partners or peers, and they represent choices that will directly impact the purchaser's physical satisfaction. When researchers examined the best-selling sex toys across 8 major adult product distributors, focusing specifically on items designed for vaginal insertion, a clear pattern emerged that contradicted much of the popular narrative about size preferences. The most commonly purchased insertable lengths fell consistently within the range of 4 to 6 inches. This finding alone should give pause to anyone who has internalized the cultural message that bigger is invariably better. But the data becomes even more revealing when you look at the specifics. On 6 out of those 8 websites analyzed, the average length of the best-selling toys measured less than 6 inches. The average circumference came in at less than 4.5 inches. These measurements align remarkably closely with what medical research has established as the average dimensions of a natural erect penis. For context, extensive studies on male anatomy have consistently found that the vast majority of men fall between 5 and 6 inches in length when fully erect, with the circumference typically ranging from 4.5 to 5 inches. This represents the normal distribution, the statistical middle ground, where most of the population clusters. The sex toy data suggests that when women make private purchasing decisions, they are overwhelmingly choosing products that mirror these average natural dimensions. They are not seeking out the extreme sizes that dominate jokes, pornography, or anxious male fantasies about inadequacy. Instead, they are selecting products that feel comfortable, pleasurable, and functional for their own anatomical realities. Another study took a slightly different approach by focusing specifically on realistic dildos, those designed to closely mimic the appearance and feel of actual penises. The researchers limited their analysis to bestsellers from the top 5 adult retailers in the United States, plus Amazon, which has become a major player in the discreet sale of intimate products. In this particular analysis, the average insertable length came out to approximately 16.7 centimeters, or about 6.5 inches. This is indeed slightly longer than the statistical average for natural penises, but the difference is modest rather than dramatic. This finding suggests something interesting about female sexuality and curiosity. Perhaps some women enjoy experimenting with something that falls just above the average range, exploring sensations that come with a bit of extra length. But even in this context, the preferences remain relatively moderate. There is no evidence here of women seeking out the exaggerated dimensions that dominate adult entertainment, or become the subject of size-obsessed cultural narratives. What makes this research even more compelling is an additional layer of analysis that examined not just what sizes were popular, but what factors actually drove purchasing decisions in the sex toy market. This is where the findings become particularly illuminating for anyone worried about their own measurements. Researchers discovered that price point and circumference had a significantly stronger influence on purchase behavior than insertable length did. Let that sink in for a moment. When women were shopping for pleasure products, many of them prioritized affordability and girth over maximum length. This preference makes perfect physiological sense. The vagina is not a uniform tube, but a complex structure with concentrated nerve endings in certain areas, particularly in the outer third. For many women, the sensation of fullness, which correlates more with girth than length, provides more pleasurable stimulation than deep penetration. Meanwhile, excessive length can actually be uncomfortable or even painful if it results in forceful contact with the cervix, which is quite sensitive and not in a pleasurable way for most women. Perhaps most tellingly, the research revealed that toys with larger than average girth were frequently less popular than those with average dimensions. This pattern directly contradicts the assumption that women universally prefer maximum size in all dimensions. Instead, it points toward a preference for proportions that feel comfortable and manageable. A toy that is too girthy can cause discomfort, difficulty with insertion, or even pain during use. Women making these purchasing decisions are clearly prioritizing their own physical comfort and pleasure over any abstract notion of impressive size. They are being practical about what actually works for their bodies, rather than selecting products based on what they think they should want, or what popular culture suggests they should prefer. When you step back and look at the totality of this purchasing data, a coherent picture emerges. Given complete freedom to choose any size imaginable, with products available in virtually every dimension you could conceive of, most women consistently opt for something that falls within or just slightly above the average range for natural penises. They are not purchasing the extreme sizes that manufacturers offer. They are not seeking out products that would fulfill the stereotypical fantasy of enormous proportions. Instead, they are making pragmatic choices based on what provides them with actual physical pleasure and comfort. This is the reality of female preference, when it is measured through behavior, rather than filtered through the distorting lens of social expectations, media influence, or the pressure to conform to certain narratives about sexuality. This behavioral data stands in stark contrast to the messages that saturate popular culture. Scroll through social media for any length of time, and you will inevitably encounter jokes about penis size, memes celebrating extreme dimensions, or comments that seem to suggest bigger is always better. Sit through enough conversations at parties or in social settings, and you will hear women casually claim preferences for sizes that would place them in statistical outlier territory. But here is the critical insight that this research provides. What people say in public, what they joke about, what they claim as preferences in social contexts often differs dramatically from what they actually choose when they are alone and making decisions purely for their own satisfaction. The sex toy market data represents unfiltered preference, the choices women make when there is no audience to perform for, no social capital to be gained, and no reason to exaggerate or conform to expectations. The implications of this research extend far beyond simple reassurance, though that is certainly part of the value. For the vast majority of men who fall within the normal range of dimensions, these findings should provide genuine comfort. If you measure somewhere between 5 and 6 inches in length and around 4.5 to 5 inches in circumference, you are not just within normal range. You are aligned with what women actually select when choosing products for their own pleasure. You are not lacking or inadequate. You are, in the most literal sense, exactly what most women choose when given unlimited options. The anxiety that many men feel about their size, the comparisons they make, the worries that plague their confidence. These concerns are largely based on distorted cultural narratives rather than female reality, but there is additional nuance worth exploring. Some research has examined whether certain types of orgasmic response correlate with size preferences. Studies have shown that women who report regularly experiencing vaginal orgasms, as opposed to those achieved primarily through clitoral stimulation, sometimes express a slight preference for longer penile length. However, even in these cases, the preferences are for modest increases rather than extreme dimensions. We are talking about women who might prefer something in the 6 to 7 inch range rather than the 5 to 6 inch average, not the exaggerated proportions that dominate pornography or anxious male imagination. And it is worth emphasizing that vaginal orgasms represent just one type of female sexual response, and not necessarily the most common or the most satisfying for all women. Many women achieve their most intense orgasms through clitoral stimulation, for which penile size is largely irrelevant. This brings us to perhaps the most important point in this entire discussion, something that can get lost in the focus on measurements and statistics. Sexual satisfaction and connection involve vastly more than physical dimensions. The research on sex toy preferences tells us something useful about basic physical compatibility and comfort, but it cannot capture the full complexity of human sexuality. A fulfilling sexual relationship depends on factors like communication, emotional intimacy, attentiveness to a partner's responses, willingness to learn and adapt, and the confidence to be present and engaged during intimate moments. These psychological and relational elements often matter far more than any measurement possibly could. Consider what actually happens during satisfying sexual encounters. Partners who communicate openly about what feels good, who pay attention to responses, and adjust accordingly, who create an atmosphere of safety and acceptance. These are the people who tend to have the most fulfilling intimate lives. A man who is attentive, patient, skilled with his hands and mouth, and emotionally connected will almost always provide more satisfaction than someone who simply possesses certain dimensions but lacks these other qualities. Women consistently report that factors like feeling desired, emotional connection, adequate foreplay, and a partner who cares about their pleasure rank far higher in importance than physical measurements. The obsession with size, which causes so much male anxiety, often misses the point entirely about what creates genuine sexual satisfaction. Furthermore, female anatomy varies considerably from person to person, just as male anatomy does. Some women have shorter vaginal canals, while others have longer ones. Some find deeper penetration uncomfortable, regardless of arousal level, while others enjoy it. Some are particularly sensitive to girth, while others focus more on other aspects of stimulation. There is no single ideal that works for all women, because women are not a monolithic group with identical anatomical structures and identical preferences. What this means practically is that sexual compatibility is not about meeting some universal standard of dimension, but rather about finding rhythm and technique that works for the particular individuals involved. A couple that takes time to explore, communicate, and discover what feels best for both partners will find satisfaction, regardless of whether measurements fall at the statistical average, slightly below it, or slightly above it. The market research on sex toys also reveals something about how women think about their own pleasure. By choosing average-size products that prioritize comfort and realistic proportions, women are demonstrating a practical, self-aware approach to their sexuality. They are not chasing an idealized fantasy that might look impressive but feel uncomfortable. They are not trying to push their bodies to accommodate something extreme just for the sake of saying they did. Instead, they are selecting what actually works, what actually feels good, and what they can use repeatedly for genuine satisfaction. This pragmatic approach to pleasure stands in interesting contrast to the way penis size is often discussed in broader culture, where exaggeration and bravado tend to dominate the conversation. There will always be statistical outliers. Of course, in any large population, you will find some women who genuinely prefer dimensions at the far end of the distribution, just as you will find some who prefer the smaller end. Human sexuality encompasses tremendous diversity and generalizations. Even those based on solid research cannot account for every individual preference. But these outliers, by definition, do not represent the typical experience or preference. The woman who casually mentions at a party that she only dates men with very large penises might genuinely have that preference, or she might be performing for her audience, saying what she thinks sounds impressive, or what conforms to certain cultural scripts about female sexuality. Even if her preference is genuine, she represents a small minority rather than the norm. The mistake many men make is hearing these outlier voices and assuming they represent universal female preference, when the actual behavioral data suggests otherwise. The psychological impact of size anxiety cannot be understated. Many men carry deep insecurity about their dimensions, constantly comparing themselves to unrealistic standards perpetuated by pornography, worried that they cannot satisfy a partner, anxious about how they measure up. This anxiety can become self-fulfilling in damaging ways. A man who is preoccupied with worries about inadequacy during intimate moments is not fully present with his partner. He is distracted, self-conscious, and unable to relax into the experience. This mental distraction and lack of confidence can undermine sexual performance far more than any actual physical characteristic. Partners can sense when someone is anxious or withdrawn, and it affects the quality of connection and intimacy. Ironically, the size anxiety itself often creates more problems than the actual dimensions ever would. Knowledge can be a powerful antidote to this anxiety. Understanding what the research actually shows, seeing that behavioral data contradicts the cultural narratives that fuel insecurity, can help men develop the confidence to be fully present during intimate moments. When you understand that you fall within the range that most women actively choose for their own pleasure, when you recognize that the extreme preferences loudly proclaimed in some social contexts do not match up with the quiet private choices women make, it becomes easier to set aside the comparisons and worries. This mental shift, this movement from anxiety to confidence, can transform intimate experiences in ways that have nothing to do with physical dimensions and everything to do with psychological presence and emotional availability. The sex toy research also implicitly acknowledges something important about female pleasure that extends beyond penetrative sex entirely. Many of the best-selling toys in the adult product market are not dildos at all, but vibrators designed primarily for clitoral stimulation. The clitoris, with its thousands of nerve endings, is the primary source of orgasm for most women. While some women greatly enjoy penetrative sex and can orgasm from it, many others require direct clitoral stimulation to reach climax. This anatomical reality means that even in contexts where penis size might theoretically matter, it is often not the determining factor in whether a woman experiences orgasm or satisfaction. A partner who understands this, who incorporates manual or oral stimulation, who recognizes that penetration is just one component of sexual activity rather than the entirety of it, will generally provide much more satisfaction than someone focused solely on penetrative intercourse, regardless of dimensions. Cultural narratives about masculinity have long intertwined with penis size in problematic ways. Men are socialized to believe that their sexual adequacy and even their masculine identity are tied to their measurements. This creates enormous pressure and anxiety, particularly during adolescence and young adulthood, when men are still developing their sense of self and their confidence in intimate situations. The reality revealed by sex toy purchasing data and other behavioral research challenges these harmful narratives. Adequacy and masculinity have nothing to do with measurements and everything to do with how you show up as a partner, how you treat people, how you communicate, and how you navigate intimacy with respect and attentiveness. Dismantling the false connection between size and worth is essential for male psychological well-being and for creating healthier, intimate relationships. The research also highlights the gap between fantasy and reality in sexual preferences. Adult entertainment, which many people consume as a form of sexual education, despite it being designed purely for entertainment, overwhelmingly features performers selected for atypical physical characteristics. Male performers in pornography often possess dimensions well above average, while scenes are choreographed and filmed to emphasize size, in ways that do not reflect typical sexual encounters. For young people especially, exposure to this material without adequate context can create distorted expectations about what is normal or desirable. The sex toy data provides a useful correction to these distortions. It shows that when real women make real choices for real pleasure, they select products that look nothing like what dominates pornography. They choose average, comfortable, functional dimensions that work for their actual bodies, rather than products designed to match pornographic fantasy. Understanding all of this research and its implications does not mean dimensions are completely irrelevant to sexual experience. Physical compatibility does exist, and for some couples, differences in size and anatomy might require adaptation, experimentation, or certain adjustments to find what works best. But this is true across the entire spectrum of dimensions, not just for men who worry they are too small. A man at the larger end of the distribution might need to be particularly careful about depth and use positions that allow his partner to control penetration to avoid discomfort. A man at the smaller end might find certain positions provide better angles and more consistent contact. These are practical considerations that any thoughtful couple navigates together through communication and experimentation. They do not represent fundamental problems or inadequacies, just the reality that all bodies are different, and sexual satisfaction requires partners to pay attention and adapt to each other. The bottom line that emerges from all this research is both simple and profound. The vast majority of men possess dimensions that align closely with what women actually choose when selecting products for their own pleasure. The cultural narratives that create so much anxiety, the jokes and comparisons and exaggerations, do not reflect the reality of female preference, as revealed through behavioral data. Average is not a consolation prize or a compromise. It is genuinely what most women prefer, what feels best, what they actively select over available alternatives. For men carrying insecurity about their bodies, this should provide meaningful reassurance. You are not lacking. You are not inadequate. You are, quite literally, what most women choose when given unlimited options and no reason to exaggerate or perform.